Did you know that harsh medications that can be designed to save your life could also destroy your fertility? Luckily, Trina found out and took action before it was too late.
2 years ago, I was diagnosed with aplastic anemia, a blood disorder, which usually requires chemotherapy for treatment. At the time, my mom asked the doctors if I should be worried about my fertility. When they said yes, we decided to start looking for a doctor to freeze and store my eggs. So we found Dr. Sher, who was able to preserve my eggs and give me the ability to have a child someday, and I'm so grateful for that.
I want everyone to welcome Trina and her fertility specialist, Dr. Geoffrey Sher, the Executive Medical Director of Sher Institutes of Reproductive Medicine. Welcome to you both. And Trina, we haven't talked a lot about aplastic anemia on the show, and I just want to highlight what that is. It's when your bone marrow does not produce enough blood cells, and it can be all lines of the blood cells, your platelets, your red blood cells, your white blood cells. You can feel fatigued from it. You can have trouble fighting off infections. You can have bleeding issues. So that's part and parcel from what we're discussing today. You were worried about getting chemotherapy and having it affect your fertility. Real quickly, your treatment with aplastic anemia, you were able to avoid chemotherapy, correct?
Correct. So at the point when I was diagnosed, immediately they said I would need to have chemotherapy and a bone marrow transplant. That's when I found Dr. Sher, who was able to preserve my eggs and freeze them for me.
So a big question for Dr. Sher is, what is the effect of anyone that has to go undergo chemo for cancer or a condition like aplastic anemia? What effect does that have on the ovaries?
It accelerates the onset of the menopause, and it damages the eggs, and in many cases renders the woman completely infertile and unable to have a baby.
What is your retrieval process?
The first thing is to have an ultra-rapid way of freezing eggs, because before we used to damage the eggs and the embryos by freezing them slowly. Ice would form inside the cells and damage them. But with vitrification, it's an ultra-rapid freezing method 600 times faster. So it doesn't allow ice to form in the cells and doesn't damage them. That's the one step. But the other step is that we now are doing genetic selection of the eggs. We can do a test called CGH, which tells us which egg is the one likely to make a baby. And in the process, we can improve the baby rate per egg tenfold over conventional methods. In the case of Trina, out of, I think, 7 or 8 eggs, we got 4 that were genetically normal. Each one of those eggs that we froze, now instead of a 3 to 4% chance of propagating a baby, will have about a 30% chance. And each embryo we put in will have about a 70% chance of creating a pregnancy because it's genetically selected. And that's what makes this process completely unique.
Now, Dr. Sher, I'm curious, what sort of patients come to see you? You know, who's your kind of regular clientele?
Well, interestingly, the most common patient is someone who wants to improve their options for future, people that want to defer having children, because they're not in a relationship they feel comfortable with or otherwise. But now, with a new program we've introduced called Fertility Rescue throughout the United States, because we have IVF programs in other places, we're offering free egg freezing to patients who have cancer going in for treatment. They can simply go and contact us, and we'll do absolutely free egg freezing and selection of eggs and store them for these people.
Well, you know, this involves a lot of work on your part. I'm curious, what would be the costs of doing something like this for a patient?
Well, ordinarily it would cost someone between $10,000 and $15,000 to do this, and that's not counting the medications. So we're literally providing that free of charge, but only to patients that are in dire need because of cancer, because of some other condition that can threaten their future.
You could have a condition and you could, want the options of a baby, but if you don't, and we have the research, but if you don't have the money now, you're still out of luck. So
that's the tragedy.
Yeah.
The tragedy is that the pocketbook dictates whether you can have a family, and these people are caught unawares with enough problems to deal with. Our goal is to try to open the door to these people without any other agenda.
Thank you so much, Dr. Sher and Trina. Thank you.